Starting with the next topic, that is trigeminal nerve, which is also known as dentist nerve, because here we have maxillary and the mandibular nerve, which is of utmost importance to us, or it is also known as trifacial and the fifth cranial nerve. It is derived from the first pharyngeal arch and it is the largest cranial nerve, which is a mixed type of nerve where you have a small motor root and a larger sensory root. Starting with the motor root of the trigeminal nerve, so it is going to arise separately at the pons, and below the semilunar ganglion, it will go towards the foramen ovale, leaving the middle cranial fossa, and after that it is going to unite with the sensory root and it is going to form a single nerve trunk. So it supplies various muscles, that is muscles of mastication, that is your temporalis masseter, medial and the lateral pterygoid. Then it is going to supply the mylohyoid muscle and the anterior belly of digastric, tensor tympani and also tensor villi palatini. So the sensory root, it arises from the trigeminal ganglion and it has two branches, that is central and the peripheral. So peripheral branches, they form these three main branches, that is the ophthalmic, maxillary and mandibular. Ophthalmic branch, it leaves the skull through superior orbital fossa, maxillary it leaves through foramen rotundum and mandibular it leaves through foramen ovale. Now we are going to start with the all main three nerves. So ophthalmic nerve. So it is the superior division and the smallest, and it leaves the skull through superior orbital fissure and it is completely sensory. It has three main branches, that is lacrimal nerve, frontal nerve and nasociliary. So lacrimal nerve, it is the smallest and it supplies the lacrimal gland and conjunctiva. The frontal nerve, it is divided into two branches, that is supraorbital and supratrochlear. And nasociliary, it is divided into three main branches, that is the branch which is going to go in the orbit, branches in the nasal cavity, and there are some terminal branches which are going to go on the face. So branches of orbit are long ciliary nerve, posterior and anterior ethmoidal nerve and internal and external nasal nerve. The next nerve is the maxillary nerve. So it is the second and intermediate division and again it is completely sensory. So it begins at the middle of the trigeminal ganglion. It passes through the cavernous sinus and it will leave the skull through the foramen rotundum. After that, it crosses the pterygopalatine fossa, which will give branches to the spinopalatine ganglion, and it also give a branch that is known as posterior superior alveolar nerve and the zygomatic branches. It then enters the orbit through inferior orbital fissure and it becomes infraorbital nerve, and later it is divided into various terminal branches. The maxillary nerve, it gives off branches into four groups. So the first one is within the cranium. So immediately after separating from the trigeminal ganglion, it gives off a small branch that is known as middle meningeal nerve. The second group is where it is going to give branches in the pterygopalatine fossa. So after leaving the cranium, it crosses the fossa and gives several branches, that is the zygomatic, pterygopalatine and posterior superior alveolar nerve. So the zygomatic nerve, it is again divided into two branches, that is the zygomatico-temporal nerve and zygomatico-facial nerve. And just before leaving the orbit, it gives or it sends a branch that is going to communicate with the lacrimal nerve of the ophthalmic branch. The branches of the pterygopalatine nerves are the ones which are going to supply four areas. So they are the orbital nerve, nasal branches, palatine branches and pharyngeal branches. This nasal branches, it has one significant branch which is known as nasopalatine nerve, which is going to provide sensation to the palatal mucosa in the premaxilla. And the palatine branches, it includes greater and lesser palatine nerve. And lastly, posterior superior alveolar nerve, it is the main trunk of the maxillary division in the pterygopalatine fossa. So it provides sensory innervation to the alveoli, PDL and the pulpal tissues of the maxillary molar except the mesiobuccal root of the first molar. So the third group is the branches in the infraorbital canal. So it gives two main branches, that is the middle superior alveolar and the anterior superior alveolar. The middle superior alveolar, it provides innervation to the premolars and the mesiobuccal root of the first molar, and anterior superior alveolar nerve, it innervates the anteriors and they are termed as infraorbital nerve. And last group is the branches on the face. So infraorbital nerve, it emerges onto the face and it divides into terminal branches that are inferior palpebral, external nasal and the superior labial, that is, it is going to innervate the lateral aspect of the nose, upper lip and the lower eyelid. Lastly, moving towards the last nerve, that is the mandibular nerve. So it is a mixed nerve with two roots, that is a larger sensory root and a smaller motor root. So motor root, it arises from the motor cells in the pons and medulla oblongata, and the sensory root, it arises at the trigeminal ganglion. After that, it will go through the foramen ovale and it will unite and form a main trunk outside the cranium, giving the undivided branches. So they are the nervus spinosus and the medial or the internal pterygoid nerve. Later on, it will go and divide into smaller anterior division and a posterior larger division. So anterior division, it provides the motor innervation to the muscles of mastication and the sensory innervation to the mucous membrane of the cheek and the buccal mucosa of the mandibular molar. And it also has a branch which is known as buccal nerve, which supplies the soft tissue on the buccal surface of the mandibular molar. And the posterior division, it has three branches, that is the auriculotemporal, lingual and inferior alveolar nerve. So lingual nerve, it is the sensory tract to the anterior two-thirds of the tongue and also the mucous membrane of the floor of the mouth and the gingiva on the lingual aspect of the mandible. And inferior alveolar nerve, it enters the mandibular canal and it travels anteriorly, and later it is going to divide into two branches, that is the incisive and the mental branch. So mental branch, it supplies the chin and the lower lip, and incisive branch, it is going to supply the premolars and the anteriors. So this posterior division, it also has a mylohyoid nerve. So that was all about the trigeminal nerve. Thank you so much.